121. A nurse is caring for a patient with a severe allergic reaction. What is the first priority? A. Administer antihistamines. B. Apply a cold compress to the affected area. C. Administer epinephrine as ordered. D. Assess the patient's vital signs. Answer: C. Administer epinephrine as ordered. Rationale: epinephrine is the first-line treatment for severe allergic reactions, as it can rapidly reverse symptoms like airway constriction. 122. A nurse is educating a patient with hypertension on lifestyle changes. Which of the following should be prioritized? A. Reducing sodium intake. B. Increasing caffeine consumption. C. Reducing daily physical activity. D. Avoiding medications. Answer: A. Reducing sodium intake. Rationale: reducing sodium intake helps lower blood pressure and is a key component of managing hypertension. 123. Which of the following is an important consideration when caring for a patient with diabetes? A. Encouraging the patient to eat high-sugar snacks for energy. B. Monitoring blood sugar levels regularly and adjusting insulin as needed. C. Restricting all carbohydrate intake. D. Encouraging the patient to avoid all forms of physical activity. Answer: B. Monitoring blood sugar levels regularly and adjusting insulin as needed. Rationale: regular monitoring of blood sugar is essential for managing diabetes and preventing complications. 124. A nurse is caring for a patient who is experiencing a seizure. What should the nurse do first? A. Insert a bite block into the patient's mouth. B. Hold the patient down to prevent injury. C. Place the patient on their side and protect their head. D. Administer anticonvulsant medication immediately. Answer: C. Place the patient on their side and protect their head. Rationale: placing the patient on their side helps prevent aspiration, and protecting their head reduces the risk of injury during a seizure. 125. What is the most important nursing intervention when caring for a patient with a chest wound? A. Cover the wound with a sterile dressing and tape it securely. B. Administer pain medications as prescribed. C. Apply an airtight dressing to prevent air from entering the wound. D. Encourage the patient to breathe deeply to promote lung expansion. Answer: C. Apply an airtight dressing to prevent air from entering the wound. Rationale: an airtight dressing helps prevent air from entering the chest cavity, which can cause a tension pneumothorax. 126. A nurse is preparing to administer a blood transfusion to a patient. What is the most important action to take? A. Administer the blood at the fastest rate possible. B. Verify the patient's identity and blood type with another nurse. C. Premedicate the patient with antihistamines. D. Warm the blood before administration. Answer: B. Verify the patient's identity and blood type with another nurse. Rationale: verifying the patient's identity and blood type reduces the risk of administering the wrong blood type, which could be fatal. 127. A nurse is caring for a patient with a urinary tract infection (UTI). What is the most important nursing action? A. Encourage fluid intake to flush out the infection. B. Restrict the patient's fluid intake to reduce urinary frequency. C. Use a sterile catheter to collect urine samples. D. Administer antibiotics as ordered and monitor for side effects. Answer: A. Encourage fluid intake to flush out the infection. Rationale: increased fluid intake helps flush out bacteria from the urinary tract, which can aid in the recovery from a UTI. 128. When administering medications to a pediatric patient, what is the most important consideration? A. Giving the medication as fast as possible to reduce discomfort. B. Using a medication dosage appropriate for the child's age and weight. C. Always using liquid forms of medication, regardless of the child's age. D. Giving the child a reward after taking the medication. Answer: B. Using a medication dosage appropriate for the child's age and weight. Rationale: pediatric dosing is based on weight and age to ensure safe and effective medication administration. 129. Which of the following is the most important step in preventing the spread of infection in a healthcare setting? A. Performing hand hygiene regularly. B. Wearing gloves at all times. C. Administering antibiotics to all patients. D. Ensuring all surfaces are cleaned with disinfectant. Answer: A. Performing hand hygiene regularly. Rationale: hand hygiene is the most effective measure to prevent the spread of infections in healthcare settings. 130. A nurse is caring for a patient with a terminal illness. Which approach is most appropriate when discussing the patient's condition? A. Encourage the patient to remain hopeful and focus only on the positive. B. Avoid discussing the patient's condition to prevent distress. C. Be honest about the prognosis while providing emotional support. D. Focus only on pain management and avoid emotional conversations. Answer: C. Be honest about the prognosis while providing emotional support. Rationale: honest communication about prognosis, coupled with emotional support, helps the patient make informed decisions and cope with their illness. 131. What is the priority nursing action when caring for a patient with an open fracture? A. Clean and irrigate the wound. B. Immobilize the affected limb. C. Administer pain medication as prescribed. D. Assess for signs of infection. Answer: B. Immobilize the affected limb. Rationale: immobilizing the limb helps prevent further injury and complications, such as vascular or nerve damage. 132. A nurse is educating a patient about the use of an inhaler. What is the most important teaching point? A. Inhale quickly and forcefully when using the inhaler. B. Rinse the mouth after each use to prevent thrush. C. Only use the inhaler when you experience symptoms. D. Keep the inhaler in a warm, humid place for easy access. Answer: B. Rinse the mouth after each use to prevent thrush. Rationale: rinsing the mouth after using an inhaler reduces the risk of fungal infections, such as thrush. 133. A nurse is caring for a patient who is receiving chemotherapy. What is the most important action to monitor for during treatment? A. Changes in vital signs. B. The patient's emotional state. C. The onset of nausea and vomiting. D. The appearance of hair loss. Answer: C. The onset of nausea and vomiting. Rationale: chemotherapy often causes nausea and vomiting, which can lead to dehydration and electrolyte imbalances. 134. Which of the following should a nurse do when assessing a patient for pain? A. Rely solely on the patient's vital signs. B. Use a pain assessment tool, such as the numeric rating scale. C. Avoid discussing pain with the patient to prevent distress. D. Always administer pain medications immediately, without assessment. Answer: B. Use a pain assessment tool, such as the numeric rating scale. Rationale: a standardized pain assessment tool helps accurately evaluate the patient's pain and guide treatment decisions. 135. What is the best nursing action when caring for a patient experiencing dyspnea? A. Place the patient in a supine position to promote lung expansion. B. Administer oxygen as prescribed. C. Restrict fluid intake to reduce respiratory distress. D. Encourage the patient to take shallow breaths to avoid discomfort. Answer: B. Administer oxygen as prescribed. Rationale: oxygen administration improves oxygenation and helps alleviate the discomfort associated with dyspnea. 136. A nurse is caring for a patient who has just received a pacemaker. What is an important instruction for the patient post-procedure? A. Avoid lifting heavy objects for at least 2 weeks. B. Return to normal activity immediately after discharge. C. Sleep on the side of the implanted pacemaker. D. Limit fluid intake for 24 hours following the procedure. Answer: A. Avoid lifting heavy objects for at least 2 weeks. Rationale: after pacemaker implantation, avoiding heavy lifting prevents strain on the pacemaker and the insertion site. 137. A nurse is caring for a patient with chronic obstructive pulmonary disease, COPD. Which action should be prioritized? A. Administering high-flow oxygen therapy to ensure adequate oxygenation. B. Encouraging the patient to participate in deep breathing exercises. C. Encouraging fluid intake to thin respiratory secretions. D. Limiting physical activity to prevent exacerbation of symptoms. Answer. B. Encouraging the patient to participate in deep breathing exercises. Rationale. Deep breathing exercises help improve lung function and reduce the work of breathing in patients with COPD. 138. What is the priority nursing action for a patient experiencing anaphylaxis? A. Administer antihistamines as prescribed. B. Apply a cold compress to the affected area. C. Administer epinephrine immediately. D. Place the patient in a semi-Fowler's position. Answer. C. Administer epinephrine immediately. Rationale. Epinephrine is the first-line treatment for anaphylaxis to rapidly reverse airway constriction and other severe symptoms. 139. A nurse is providing education to a patient with congestive heart failure. What is the most important information to include? A. Limit sodium intake and monitor fluid balance. B. Avoid any physical activity to reduce strain on the heart. C. Take prescribed diuretics only when feeling short of breath. D. Use a low-fat diet to prevent weight gain. Answer. A. Limit sodium intake and monitor fluid balance. Rationale. Sodium restriction and fluid balance management are key components of managing congestive heart failure. 140. What is the priority nursing intervention for a patient with a wound infection? A. Administer pain medication. B. Apply a warm compress to the wound. C. Notify the healthcare provider about the infection. D. Assess the wound for drainage and other signs of infection. Answer. D. Assess the wound for drainage and other signs of infection. Rationale. Proper assessment of the wound helps guide further treatment and interventions to address the infection. 141. A nurse is caring for a patient who is post-operative after a hip replacement. What is the most important priority for this patient? A. Encourage early ambulation. B. Monitor the patient's intake and output. C. Apply ice packs to reduce swelling. D. Administer pain medications as prescribed. Answer. A. Encourage early ambulation. Rationale. Early ambulation helps prevent complications such as deep vein thrombosis, DVT, and promotes healing and recovery. 142. A nurse is assessing a patient's pain using a numeric rating scale, 0 to 10. The patient rates their pain as 8. What should the nurse do next? A. Administer pain medication as prescribed. B. Reassure the patient that pain is normal. C. Encourage the patient to relax and breathe deeply. D. Document the pain rating and continue to monitor. Answer. A. Administer pain medication as prescribed. Rationale. When a patient rates pain as 8, it is important to address the pain promptly with appropriate medication as prescribed. 143. A nurse is caring for a patient with a history of alcohol use disorder. Which of the following is the priority assessment for this patient? A. Blood alcohol level. B. Nutritional status. C. Liver function tests. D. Withdrawal symptoms. Answer. D. Withdrawal symptoms. Rationale. Withdrawal symptoms can be life-threatening and should be prioritized for early intervention and management. 144. A nurse is caring for a patient with chronic kidney disease. Which of the following interventions is most important? A. Limit potassium intake. B. Encourage high-protein diet. C. Encourage fluid intake. D. Restrict sodium intake. Answer. A. Limit potassium intake. Rationale. In chronic kidney disease, impaired kidney function leads to the accumulation of potassium, which can cause life-threatening hyperkalemia. 145. A nurse is preparing to administer an intramuscular injection. Which site should the nurse choose? A. Dorsogluteal site. B. Ventrogluteal site. C. Deltoid muscle. D. Vastus lateralis. Answer. B. Ventrogluteal site. Rationale. The ventrogluteal site is the preferred site for intramuscular injections because it has the least risk for injury to blood vessels and nerves. 146. A nurse is caring for a patient with chronic obstructive pulmonary disease, COPD. Which of the following should be prioritized in the patient's care plan? A. Administer high-flow oxygen therapy to improve oxygenation. B. Encourage smoking cessation to prevent further lung damage. C. Recommend complete bed rest to reduce fatigue. D. Encourage deep breathing exercises and pursed lip breathing. Answer. D. Encourage deep breathing exercises and pursed lip breathing. Rationale. Deep breathing exercises and pursed lip breathing help improve airflow and decrease shortness of breath in COPD patients. 147. A nurse is caring for a patient who is undergoing chemotherapy. The patient complains of severe nausea. Which intervention is most appropriate? A. Administer antiemetic medication as prescribed. B. Encourage the patient to take fluids frequently. C. Restrict the patient's food intake to prevent vomiting. D. Allow the patient to eat high-fat, greasy foods. Answer. A. Administer antiemetic medication as prescribed. Rationale. Antiemetic medications are prescribed to manage chemotherapy-induced nausea and vomiting and should be administered promptly. 148. A nurse is caring for a patient who is being discharged after a myocardial infarction. Which instruction is most important for the patient to follow? A. Limit physical activity for several weeks. B. Take prescribed medications as ordered. C. Avoid any stressful situations. D. Return to normal activities immediately to prevent further heart strain. Answer. B. Take prescribed medications as ordered. Rationale. Adherence to prescribed medications is essential in preventing complications and managing the patient's condition after a myocardial infarction. 149. A nurse is educating a patient with type 2 diabetes on dietary changes. Which food choice is most appropriate? A. White bread. B. Roasted vegetables. C. Fruit juices. D. Sweetened cereals. Answer. B. Roasted vegetables. Rationale. Roasted vegetables are low in sugar and carbohydrates, making them an appropriate food choice for managing type 2 diabetes. 150. A nurse is assessing a postoperative patient for signs of deep vein thrombosis, DVT. Which of the following is a key sign to monitor for? A. Hematuria. B. Calf pain and swelling. C. Excessive bleeding from the surgical site. D. Low-grade fever. Answer. B. Calf pain and swelling. Rationale. Calf pain and swelling are common signs of DVT, and prompt identification is crucial to prevent further complications. 151. A nurse is caring for a patient with a history of heart failure. Which of the following signs or symptoms should the nurse prioritize? A. Increased appetite. B. Decreased urinary output. C. Increased thirst. D. Swelling of the ankles. Answer. B. Decreased urinary output. Rationale. Decreased urinary output in a heart failure patient can indicate fluid retention and worsening of heart failure. 152. A nurse is caring for a patient with a hip fracture. Which intervention is most important to prevent complications? A. Encourage the patient to perform leg exercises. B. Apply a traction device to the leg. C. Administer pain medications as prescribed. D. Monitor for signs of infection at the surgical site. Answer. A. Encourage the patient to perform leg exercises. Rationale. Leg exercises help improve circulation, prevent DVT, and promote healing following a hip fracture. 153. A nurse is caring for a patient receiving a blood transfusion. Which action should the nurse take if the patient begins to exhibit signs of an allergic reaction? A. Stop the transfusion and notify the healthcare provider. B. Increase the rate of the transfusion. C. Apply warm compresses to the site of the transfusion. D. Continue the transfusion but monitor closely. Answer. A. Stop the transfusion and notify the healthcare provider. Rationale. An allergic reaction to a blood transfusion requires immediate cessation of the transfusion and prompt medical intervention. 154. A nurse is educating a patient with asthma on how to use a metered dose inhaler. Which instruction is most important? A. Shake the inhaler before each use. B. Inhale quickly and deeply when using the inhaler. C. Use the inhaler only during an asthma attack. D. Hold your breath for 1 second after inhalation. Answer. A. Shake the inhaler before each use. Rationale: shaking the inhaler ensures that the medication is properly mixed and ready for delivery to the lungs. 155. A nurse is preparing a patient for discharge after a stroke. What should be prioritized in discharge planning? A. Arranging for follow-up care and rehabilitation. B. Providing information on stroke prevention only. C. Focusing on teaching the patient to perform activities of daily living independently. D. Encouraging the patient to return to normal activity immediately. Answer: A. Arranging for follow-up care and rehabilitation. Rationale: stroke patients need follow-up care and rehabilitation to maximize recovery and reduce the risk of further complications. 156. A nurse is caring for a patient who has just undergone a lumbar puncture. What is the most important nursing action following the procedure? A. Encourage the patient to lie flat to prevent a headache. B. Administer pain medications to manage discomfort. C. Monitor the patient for signs of a reaction to the contrast dye. D. Allow the patient to sit up immediately to promote circulation. Answer: A. Encourage the patient to lie flat to prevent a headache. Rationale: lying flat helps prevent post-lumbar puncture headaches caused by cerebrospinal fluid leakage. 157. A nurse is caring for a patient receiving an opioid for pain management. What is the most important nursing action to monitor for? A. Nausea and vomiting. B. Respiratory depression. C. Constipation. D. Allergic reactions. Answer: B. Respiratory depression. Rationale: opioid medications can cause respiratory depression, which is the most dangerous side effect and requires close monitoring. 158. A nurse is caring for a patient who is at risk for aspiration. Which of the following is the best position to prevent aspiration during feeding? A. Semi-Fowler's position. B. Trendelenburg position. C. Prone position. D. High Fowler's position. Answer: D. High Fowler's position. Rationale: the high Fowler's position, sitting upright, reduces the risk of aspiration during feeding by promoting proper swallowing. 159. A nurse is assessing a patient with a stroke. What is the most important assessment to perform immediately? A. Check the patient's blood pressure. B. Assess the patient's level of consciousness. C. Measure oxygen saturation levels. D. Perform a neurologic assessment using the Glasgow Coma Scale. Answer: B. Assess the patient's level of consciousness. Rationale: assessing the level of consciousness is crucial for identifying the severity of the stroke and determining the appropriate intervention. 160. A nurse is preparing a patient for a colonoscopy. Which statement by the patient indicates a need for further teaching? A. I will need to fast for 24 hours before the procedure. B. I can take my usual medications with water before the procedure. C. I will need to drink a bowel cleansing solution before the procedure. D. I will need to arrange for transportation after the procedure. Answer: A. I will need to fast for 24 hours before the procedure. Rationale: patients usually fast for 12 to 24 hours before a colonoscopy, but fasting for 24 hours is excessive and may need clarification based on specific instructions from the healthcare provider.